Good morning and welcome. I'd like to start by acknowledging the traditional custodians of the land, the Yugambeh speaking people, and pay my respects to elders past and present and emerging. We'd also like to recognise those with lived experience of mental health conditions. Good morning to the Minister for the Environment and the Great Barrier Reef, and Minister for Science and Youth Affairs, Meaghan Scanlon, HHS colleagues and partners. It's a pleasure to have you here today, Minister, on the Gold Coast to make this important announcement.
Thank you very much, Malcolm, and thank you to all of the Gold Coast health team here who do amazing work every day. And as a Gold Coaster, I'm very proud to be here today for this announcement. 1 in 2 Australians suffer mental illness at some stage in their life. We all know someone who's been impacted in some way or another. Too many of us know someone who's lost someone because of suicide. I can talk about the statistics, but I think the names and the stories of those people are more powerful, and we know the ripple effect that those tragedies have on our wider community, on the first responders, on the families and the friends who continue to feel the grief and loss of that pain and that loss of those individuals. We know that the system needs to improve when it comes to mental illness. That is why our government took the brave step of doing a parliamentary inquiry into mental health to uncover some of the uncomfortable truths and to see where the systems and the services need to be improved to make sure people get the support that they need. As a result of that inquiry, last year we announced a $1.6 billion mental health investment. That investment is being delivered through a mental health levy that we have put on the top end of town. We know that Queenslanders need access to the sort of support services to make sure that they live incredible lives. And I want to acknowledge all of the amazing people in our health services who work with consumers who are suffering with mental illness every day. Those people at the Gold Coast do an incredible job, but they need the infrastructure and the facilities to be able to do that job effectively. Today, I'm really pleased to announce that Watpac Construction will be awarded the contract for the new 40-bed mental health rehabilitation unit here on the Gold Coast. This is a secure mental health facility that will be for consumers who are experiencing complex mental health. We, of course, also recently just opened the Mental Health Crisis Stabilisation Centre at Robina that's about trying to deliver a better model of care for people who are coming to our emergency departments instead of sitting in that waiting room, going to a more appropriate area that's got the clinicians that know those people and know the sort of needs that they might be experiencing. This is, as I said, all part of a $1.6 billion investment that our government is providing to make sure that we have the mental health facilities, the sort of staff, the beds, that we have appropriate drug and alcohol addiction services, and that we are making sure that we're delivering for all parts of Queensland. We also have a specific package for First Nations people. We have a specific package dedicated to child and adolescent support services, and also crisis response services and suicide prevention services. So I want to thank everyone who works in the sector. They do an incredible job, and this infrastructure will mean a lot for people on the Gold Coast who are experiencing complex mental health. It'll also mean jobs during the construction, which is wonderful to see on the Gold Coast, and I want to congratulate Watpac Construction. They're a Queensland company, so they'll be employing obviously Queenslanders to do the construction of this work in a growing part of our city. On the Gold Coast, we're investing significantly in other health services. We've obviously committed to a $1.3 billion new hospital in Coomera. The satellite hospital in Tugun is currently under construction. We also have an expansion, a 70-bed expansion of Gold Coast University Hospital that will be taking place, as well as an expansion at Robina Hospital. We know this city is growing, and that is why we are investing in the frontline services that Gold Coasters need. But it's also why we're investing across the entire state, nearly $10 billion of infrastructure to deliver 3 new hospitals, a cancer centre, as well as an expansion of 11 existing hospitals. I might hand over now or take any questions. Does anyone from Gold Coast Health want to say anything? Just questions? Does anyone have any questions for me? Or? Yeah.
I have one question about this, if that's possible.
Yeah. Okay.
Obviously, it's been quite a tough few years for everybody.
Yeah.
Has there been an increase in the need for these kind of services on the Gold Coast?
Yeah, look, we obviously know that people are experiencing mental illness. 1 in 2 Australians will experience mental illness at some point in their life. We know that over COVID, of course, people experienced that at a higher level. We also know that there's stigma associated with mental illness that we need to address. Mental illness is an illness that needs to be treated and cared for by professionals, and I think that's really important that we have those services and facilities like this to provide that appropriate level of care. But I also think we need to acknowledge that because some of that stigma, thankfully, is starting to dissipate, we're seeing more and more people who feel comfortable coming forward, and I think that's a good thing. But we need to continue to invest, and that's why we brought in this new mental health care levy to make sure that we can pay for those sort of supports that people need. Some of these supports are really complex. They take a really long time to be able to provide the sort of care that people need, and so that's expensive, and we need to be able to fund that.
Based on your question, there's all three of us, yeah?
Do you want to ask the question that we can find
I guess
out?
basically, with this whole tragedy, I mean, all the staff are being treated here at the Gold Coast University Hospital. I'm just wanting to know how amazing the staff have been to, get these patients well again.
So,
talk to that.
When anything like this,
So we'll just get you up to
yeah. So when anything like this happens in the community, it's obviously it has a significant impact, not only obviously for the people that are directly involved, but the community as a whole. And so the HHS has acted very quickly to make sure that we have provided appropriate supports for anybody else that's needed it, including QAS, etc., and counselling services, and that has been offered more broadly as well to ensure that everyone is supported during this difficult time.
And obviously, I mean, they've come in quite serious conditions. Some have even been discharged now in stable conditions. I mean, how amazing would the staff been to do that so quickly?
I mean, this is the beauty of the Gold Coast Hospital, is that the staff are dedicated and focused, and whatever the crisis, whatever the difficulty is, they do the work that is required to provide the highest level of care in difficult circumstances. And this didn't change throughout COVID. It was delivered second to none. So, it's a huge thanks to the staff here, really.
I'd like to say a huge thank you to the Gold Coast Health staff, who have obviously done everything they can to provide the sort of care that I think everyone expects in this horrible tragedy. I'm always impressed at the level of care and professionalism by all of the health staff at Gold Coast Health. They do an amazing job. They wake up every day to help people and to save people's lives, and I think we all owe them a huge debt of gratitude.
There's also, more tragedies over this last week. So the crash in Benoni earlier last weekend. So one of the relatives and families were mandatory jail time for drivers who failed to stop and collect.
Yeah, well, first I'd like to offer my deepest sympathy to the family and to the loved ones of the individuals who, of course, were a part of that horrific incident. Now, as I understand, that was reported in the paper today as well, charges have been laid and the matter is before the court. So I've got to be careful with anything that I say about the specifics of that particular matter. What I can say, though, is our government takes hooning incredibly seriously. We've brought in a number of pieces of reform to target hooning in this state. And I want to be clear, offenders can face up to life imprisonment for this type of offending. We introduced some of the toughest reforms when it comes to the evasion offences, and I think that's what community members expect.
Do you think there should be mandatory jail time for drivers that fail to stop the police, though?
I think we've got to look at the evidence and we've got to make sure that we implement measures that are reasonable. As I said, we've just brought in some incredibly tough measures, the toughest in the nation when it comes to evasion offences. People can see life imprisonment, and so my message to everyone is don't risk it. If you're going to don't drive dangerously, you will be caught and you will be punished.
Obviously there's been a lot of crime experts that have come out saying these laws aren't tough enough. Do you stand by government's new laws?
Well, some of these laws have only just been implemented, and some are still before the process of being implemented. So I think we need to allow enough time to have reforms in place and to see if they're successful or not. As I said, though, we've brought in reforms around evasion offences. We've brought in the toughest in the nation, and people can get life imprisonment. So I think that's pretty clear how seriously we take this issue, and we'll continue, as always, to look at the evidence and implement reforms that hold perpetrators to account, but also ideally stop people from engaging in this sort of behaviour to begin with.
Will the state government consult with victims' families when it comes to road safety?
We, of course, always consult with families who have been impacted by road safety. I know that is a matter that something that takes place usually when we're considering our road safety campaigns and any additional measures. They offer obviously a unique perspective in how we deal with some of these issues, and we'll always listen to the broader community and people who have been directly impacted in terms of how we can make sure we stop this sort of behaviour from occurring, so that we limit and ideally completely reduce the amount of fatalities that we continue to see on our roads.
Just on funding for the GABA, when does the state government expect to be at a point in its negotiations with the Commonwealth to be able to make its GABA redevelopment plans public?
Obviously, as soon as possible, we'd like to conclude those negotiations, but we acknowledge that there's a new federal government. We need to make sure that they're aware of all of the contract details, that they're comfortable with that, and then we can obviously proceed. We're obviously very excited about the Olympics and keen to work with all levels of government to be able to deliver the infrastructure that people want to see, and the infrastructure that will leave a long-lasting legacy. You know, I reflect on the Gold Coast Commonwealth Games and how much we've been able to utilise all of those pieces of infrastructure now. The Gold Coast Health and Knowledge Precinct is a great example of how we've turned into what was an athletes' village now into an incredible area for innovators and entrepreneurs to create jobs in that tech-based industry and science-based industry. So it's a really exciting opportunity, and we want to get it right.
Yeah, given plans haven't been announced yet and they had been expected by now, is that a delay?
Look, we obviously need to negotiate with the federal government. They are ultimately going to be contributing to this funding arrangement, and so we can't release that until we have that detail landed. But you know, the Olympics is obviously not too far away. We are focused on making sure that we get this infrastructure up off the ground as soon as possible to make sure that it's a successful Olympics. We did that for the Commonwealth Games. You know, you saw the light rail delivered in record time, on budget. All of the infrastructure was there ready to welcome people from across the world.
The Lord Mayor has expressed concern about wasting precious time. That's his quote. Does he have a point?
Look, we continue to engage with the federal government both on the GABA redevelopment and all areas where we need to work cooperatively together, whether that be on primary and allied healthcare. I know we've obviously been having very constructive conversations about how we improve the healthcare system to make sure ideally not as many people end up in hospital, and that we're providing that level of treatment in our GP services and other allied health facilities. So, we continue to engage with the federal government on all issues. I don't accept that we're not having those conversations.
Just finally, is there a situation where the state government would accept anything other than 50-50?
Our position is obviously that we would like to see 50-50 funding. We always fight for Queenslanders regardless of who's in power federally, but obviously we will provide the federal government with whatever information they need to make sure that they know that there's value for money for Queenslanders and for Australians. Excellent. Thank you.
You might have a look at some of the concepts in the announcement side.